Okay, welcome everyone. Please let me know if you can't hear me up the back. Welcome to the Teachers Federation in Surrey Hills. I'd like to start by acknowledging country. We are on Gadigal land, Gadigal of the Eora Nation, and pay my respects to elders past and present, acknowledging that sovereignty was never ceded and this always was and will be Aboriginal land. My name's Anna Brown. I'm your moderator for this evening. I'm the CEO of Equality Australia, one of the organisations involved in this forum tonight. This event will be live streamed on Zoom webinar and also, I believe, on Facebook. So welcome to those watching in from around the internet. There will be a recording available. We were due to have an Auslan interpreter who's sadly been forced to cancel at the last minute, but I'm assured that when the recording does go live, that it will be accessible to people that are hard of hearing. Without further ado, I'd love to welcome Michael West from the Metropolitan Aboriginal Land Council to the stage to provide the welcome to country. Thank you, Michael.
Good evening, everyone. I'd like to say Bajadi Gamarua and Gadigal Eora and G'day, and we're welcome here to the land of the Gadigal and Eora. And I was thinking that the times we live in are very interesting times, aren't they? Currently for the world, going through this pandemic, we're not at the end, as everybody should know, and we've still got a ways to go. And it's important. We'll have a moment's silence in a second to pay respects to those we've lost along the way in reflection. And I was thinking too that I've been waiting. I think there's a series coming on. Is it ABC? There's a series coming about AIDS, I think. Yeah. Is that starting this week or next week? Sunday. Okay. I couldn't remember, but I was thinking that'd be pretty good to watch. I think it's important to see the history and how we come together as community in that. It's so important. And we've come together with the pandemic too, because we've got far less casualties and we've got far more survivors than when you look around the world with the way things were done. And remember that those who we've lost were people who were vulnerable with underlying conditions, but that makes no difference. We lost people. And I'm thinking that with the current state of affairs in the world, we have someone in Europe who started a war, and he's saying that he's fighting Nazis, but now they're GLBTI Nazis, which is very odd and very marginalising people, which shouldn't happen. No matter what community or communities you belong to, you should be respected. You should be treated with dignity. And no matter what postcode you're born in, no matter what gender you identify, the colour of your skin, your ethnicity, the shape of your eyes, the colour of your hair, or if you don't have hair in my case, you should be respected and treated with dignity, yes. And you should be able to fulfil your dreams and aspirations. And we'll have a moment's silence to pay respects to our ancestors and pay respects to those we've lost in the pandemic. Remember, they weren't just statistics. They were people who had names, they had faces, they had their own dreams, they belonged to family and community. So we need to remember that. And pay respects to Mother Earth. She provides us with everything. And reflect your journey right here, right now, in the continuum, and pay respects to all Aboriginal Torres Strait Islander tradition owners, elders and custodians of the past, present and future. And also, I think, like with World Pride just happened and finished, it was great. I went to several events and wonderful seeing the love all around. Paying respects to the people like the 78ers who had the first Mardi Gras. Unfortunately, I couldn't go. I had a prior arrangement, commitment. The Land Council did the welcome for both Ed Sheeran concerts. So things are changing and the world is watching, I'll tell you now. But yeah, I think we should pay respects to them too, because when they first marched, the Mardi Gras, they were greeted with batons, boots and handcuffs. So we need to remember fighting for our rights is such an important thing, and people standing up for that. So if we have a moment's silence to pay respects to those who've gone before us and that, and the ancestors, and reflect our journey right here, right now. We have three beautiful waterways, the Georges, Nepean and Hawkesbury. These are the aquatic boundaries of our nation. To any of my Aboriginal and Torres Strait Islander brothers and sisters in here, in person or online or seeing a later date, we warmly welcome you from the country, the clan, the tribe and the nation you come from. And we acknowledge the land that you are on out there and the country that you're on. And all our brothers and sisters, we all belong to one tribe, and that's humanity. We warmly welcome you from family, neighbourhood, community, ultimately the country you come from, little planet Earth that we share as humans. Remember, we all belong to that one tribe, humanity. On behalf of Metropolitan Local Aboriginal Land Council, we welcome you all here. And that is from our elders, and that is from our members, and it's from the heart. And as on our sleeve here, always was, always will be Aboriginal land, which is not only on our sleeve, but is in our heart. And when you think about it, we have some very interesting conversations coming up, not just here today, but the next year or so with the voice, treaty and truth. And it's remember that the voice is only one component of moving forward and being respectful and listening to what we have to say. And as I said, look, the world is watching. If Harry Styles can wave an Aboriginal flag, if Ed Sheeran wears an Aboriginal shirt the last 2 times, raising awareness, and if Axl Rose from Gunners can wear an Aboriginal flag, the world is watching, and we should have a think about that. So enjoy tonight, ask questions, and don't be afraid to ask difficult questions, and don't hold back. I'll leave you that. And we can all be good citizens, and as Australians, have a responsibility to look after our culture and our sites, because they're your culture and sites. I mean, in New South Wales, we're lucky we have the oldest human construction in the world, the Brewarrina fish traps. So wonderful things. Thank you.
Thank you, Michael. That really was a very special welcome, and particularly acknowledging the intersectionality of our struggles. And I think I speak on behalf of everyone here where we say we stand in solidarity with you during. Yeah.
Everyone,
no, that's even better. And thank you. That was even better than I thought it was going to be. Yeah, we do stand in solidarity with you and your peoples, and we know that this is a very important but also difficult time for LGBTI First Nations people and our wonderful sister girls and brother boys. And particularly given it's 5 years since the Marriage Equality Postal Survey, I think we stand ready to pay it forward in struggle for truth, treaty and voice. I'd like to now turn to tonight. Now the biodegradable glitter has settled on World Pride, and we partied with purpose. We gathered, we dreamed, we amplified in record numbers. I think Sydney is back, let's not say from the dead, but it's definitely back. And it was really wonderful to hear voices that aren't often heard from our communities, shouting out loud and clear across the mainstream media and reverberating around New South Wales. We saw so many parts of our communities in our diversity, and some of you may have tuned into the Human Rights Conference that we held, and for those that didn't and missed it, it's also on ABC, on iView, and will be available online. But all of this happened with an election a few short weeks away, and it's probably a reason why some of the people on the stage are looking a little more tired than usual, coming straight from World Pride into an election campaign. So in a couple of short weeks, New South Wales goes to the polls, and we're here tonight to hear from 4 incredible champions of our communities about what they have to offer our communities in terms of the major issues that face us. And we're here to also ask the tough questions, as Michael said. So there will be an opportunity for questions. But before we do that, we're going to hear from each of the representatives, who I won't be introducing verbally, but they'll each have an introduction or biography on the screen. But we're interested in hearing from all of you on, not just what you can offer during times of festivity, but also 365 days a year, your forward-looking agenda for LGBTI communities, but also all of the different communities represented by the organisations that have been involved in tonight. That is people with bloodborne viruses, sex workers, and as well as LGBTIQ+ people. To talk a bit about the work that's been done to take us to tonight, some of you may have seen an election booklet, the questionnaire that was put together with no less than 9 organisations that ACON coordinated. They are ACON, of course, Black Aboriginal Corporation, Equality Australia, the Gay and Lesbian Rights Lobby, HALC, Hepatitis New South Wales, Positive Life New South Wales, the Sex Workers Outreach Project New South Wales in 2010. So the organisations worked together, created the questionnaire, and it really consolidates the policy priorities for all of the different communities that are represented by these organisations or that these organisations work with. The responses that have been received have been published online, and you can access those with the QR code that's on the screen right now. Now, not all of them have been received, so a couple of the people of the panel might be asked a few more questions than some of the others. So we're still waiting, I think, on the Labor and the Coalition responses. And once they are received, they'll be, of course, made available online. I did want to mention that, of course, our organisations together work with many overlapping communities, but we share an experience of stigma, discrimination, human rights violations, and a number of key health challenges. And we stand together tonight to call on our parliamentarians and the major parties to really support our communities and offer to remedy some of those injustices. Some of the key issues that will be addressed tonight include HIV, bloodborne viruses, and STIs, the relationship between government and community organisations, partnerships and research, inclusion in government decision-making and delivery, human rights and justice, health and access to services, alcohol and other drugs, and safety. But before we get into the questions, we're going to start with an opening statement from each of our representatives. And I think let's just warm them up a little and give them a big welcome and thank you in your busy schedules for giving up your time to speak to us tonight. We're going to start with the Honourable Brad Hazzard, Minister for Health. Over to you. And do you have a microphone?
Okay.
5 minutes.
5 minutes, heavens. Look, thank you, Anna, and thank you to obviously the other people on the forum who I know very well. And thank you to all of you. Thank you to the organisers for bringing this together. And also thank you to you for your very warm welcome to country. And I just also acknowledge the traditional owners, the Gadigal people of the Eora Nation, and thank them for their custodianship for about 60,000 years, give or take. And if there are any Aboriginal people or Torres Strait Islanders here, I particularly acknowledge you. Can I just say, look, it's great to be here. I think ACON particularly, but quite a number of the other organisations who are involved in this forum have been really very instrumental in a lot of the sharing of knowledge, which has resulted in various policy agendas over the last few years. And I've actually worked with, doesn't sound so good from a political point of view, but Penny and Alex and Jenny, but we've all worked on things together on various policy issues. And certainly going back to when I was the Attorney General, 2014, I think, 2014, Alex particularly raised a number of issues which I was able to address as the Attorney General. And I was very proud of that, actually, on behalf of the coalition, but on behalf of the government, on behalf of the community. One of them was to effectively get rid of all the convictions
for people dating back many years. And that was, in the end, it was moved by Bruce Notley-Smith. Yeah. Bruce wasn't a minister, so I did it as Attorney General. And the Parliament was as one on that. Don't get me wrong, there's a few people there that on both sides who can still be problematic, but we got that through, and that was a big plus. And I remember Alex also said to me, can you do anything about, remember this? Can you do anything about getting marriages, that was before obviously recognition of marriage? Can you get the births, deaths and marriages to make sure that was actually noted from overseas? So we managed to achieve that as well. Yeah. And so I slipped that through without too many people knowing, which was good. And as Health Minister, of course, the last 6 years, I have been very committed to trying to make sure that the entire health agency, I mean, we've got the biggest health department in the nation by a long shot, 164,000 staff, double the size of the Defence Force. But we have very, very good public health people. We have very good researchers, and they have very good relationships with the various community organisations, and that's crucial. And also with the researchers, it's crucial as to how we advance a whole lot of the challenges. But probably one of my proudest moments was actually a year ago today. I realised that as I was walking out of my office, because wasn't it the 16th of March last year, we announced the first ever LGBTIQ+ health policy. And it was exactly a year ago today. So I think, and actually at that forum that day, and I think you were there too, Alex, if you remember, were you there, Jenny? I can't remember. Penny was, I think. We had some of the 78ers actually talking about the issues that they had faced, and just having to repeat their own private circumstances with a whole sequence of health officials. So hopefully that first ever policy document, LGBTIQ+ health policy document, is already making a difference. And it's certainly intended that way. As to all the other issues, obviously bloodborne viruses, STIs and so on, HIV, New South Wales Health actually leads the nation on that. And I have to say, I don't think that's political. I think that's both sides of the Parliament would do exactly what we're doing, because we take advice from obviously people who are expert in the field, the researchers, the people at the Kirby Institute and so on. And I know we've done a lot in each of those areas, and certainly going back a few years, I remember being advised that HIV, basically 95% of people who with HIV were now under the appropriate treatment as recommended. 1 minute to go. And I could talk about this for half an hour, but anyway. And certainly the Kirby Institute, the work they were doing highlighted the fact that we had to then start getting our public health physicians to target, particularly, and our researchers, target particularly students coming in from overseas rather than our own residents. So a lot of work's being done, I think, across the board. And I'm very proud of what I think we've done over my period, but also the period of the coalition government. Having said that, there was a lot of work done under the Labor government as well previously, and I think there's not a lot of policy difference in these areas, unless I hear differently from my colleagues today. I think when you're taking the advice from the experts in health, public health, and from the researchers and from the non-government organisations, it's pretty hard to actually do something which is outside the realms of common sense and decency. So, and I thank you very much for allowing me to come and take part in the forum this afternoon. Thank you very much.
Next, we have the Honourable Penny Sharp, Shadow Minister for the Environment, Heritage and Trade.
Thanks, Anna. I'd like to begin by acknowledging the traditional owners of the land and pay my respects to elders past and present. Michael, you must be tired. I've seen you do a lot of welcomes in recent times, and you did some fantastic ones during World Pride, so thank you very much. I just want to mention while I'm standing here that I really do want to notice that the Uluru Statement from the Heart is more than just a voice. It is about recognition, and it is about a voice to Parliament, but it also is the other two bits, which is treaty and truth. And I'm really pleased, people haven't seen it, is that if Labor's elected in March, that we are going to begin the process with First Nations organisations on the consultation, which is very important, around treaty and what that would be the next step. But we're not doing that until after the voice referendum, so we don't get in the way. So very important. I want to acknowledge my colleagues on the sides here. We have actually worked together more times than I think across Parliament than probably most, actually. It's actually a rare thing. and it doesn't get rewarded very often. But I think that the work that we've been able to do, and I'll talk about reproductive rights, something that's very dear to my heart, but I know the people on this panel, we wouldn't have got decriminalisation of abortion without these three people sitting along here, and I'm very proud to actually stand with them on that issue. I also just want to acknowledge all of the organisations that have gathered the survey. The survey you should have it, Nick, because I did sign it off today. I saw it go out, but anyway, I'll chase it. And I just wanted to make a few points really in terms of what we're doing over the next 4 years. We can look back a long way, and I want to acknowledge the excellent work of the health strategy. I want to acknowledge that we made some real strides around actually dealing with the old injustices around gay hate crimes and trans hate crimes. That work still has to be done. Obviously, the Special Commission is going. We need to get a really good government response to that when that's finally finished, and I'm glad that we got there. I want to acknowledge two MPs who are leaving Parliament who were involved in that. One's Shane Mallard from the Liberal Party. You know, being an out gay MP brings with it many things, and sometimes it's about standing up around these issues, and Shane has always done that. And I want to acknowledge him, given that he's not going to be returning to the Parliament. And I want to acknowledge our friend Mark Pearson from the Animal Justice Party. He does a very good day, Edna Everidge. He has, couldn't quite get him to go into drag in Parliament, but he was close. But he's also been a real champion, and we've worked very closely with him. There's a few things that we need to do in the next Parliament, no matter who's elected. We need to keep the bipartisanship around bloodborne diseases and HIV, and working generally, I think, on health in vulnerable communities. That is, I think, probably one of the number one responsibilities that we have. It's one of the great achievements of Australian public policy that we've been able to do that for most of the time, not always, but I see that as being extremely important. We've also got bipartisanship, which is very good in around some of the reform that's yet to come, and that, of course, is conversion and suppression practices. It's very good that both major parties have got a plan about that. I don't think we should underestimate for a minute how difficult that's going to be and the conversation that we have in the community about that. But I'm really pleased that we've actually taken that next step for reform. I'm very pleased that we're going to be funding our first LGBTIQ museum in Qtopia, and which we've got agreement. And then we're going to have to work through a whole bunch of issues. There's a whole lot of law reform yet to come, whether it's in the anti-discrimination space, whether it's in the parenting space, whether it's in the Summary Offences Act and going into the survey. Sex workers, shout out for all of that. You know, there's a whole range of reviews that are coming up and are due in the next 4 years, where I think the sort of all of the organisations involved in this survey and people that we know I'm very proud to work with, and my door is always open to, we're going to have to work through some of those issues. Some I think will be easy, some I think are not going to be so easy. And I suppose my pitch to you tonight is to work with all of those that have got the door open, because we're not necessarily, I think that the LGBTIQ community particularly is going to come under attack in the next 4 years. We can see some of the campaigns that are coming our way. I've been very pleased that this state election did not reflect the type of rhetoric and appalling things that happened during the federal election, but we've got to always be watchful. And it's one of those ones where I'm actually not seeking to look for difference tonight. I'm seeking to look for allies and for all of us to stand together, because I think that's going to be the most important thing in terms of the next lot of progress that we try to get through. The one thing I do also just want to say, though, is we need to find ways to build partnerships, and this group is a very good example of that, so that we all stand together for each other's issues, not just for our individual issues. And I think that the great strength of the LGBTIQ community has been that, and I think that the great strength of having openly gay, lesbian, bisexual, hopefully one day transgender MPs in Parliament also is our ability to stand together and have made those conversations with colleagues who I think sometimes don't quite get it, sometimes willfully don't want to do it. Finally, I want to say, I'm going to hand over to these guys, but yeah, 9 days to go. You better be on the roll. Pre-poll starts on Saturday. Encourage everyone to vote, and vote for people that support the issues that we want to pursue, because we're going to need you.
Next, we have Alex Greenwich, the member for Sydney.
Thank you very much, Anna, and good evening, friends. I'd also like to thank Michael for his welcome to country. I was lucky enough to start the day with Michael at the opening of the College Street Cycleway, or reopening of the College Street Cycleway, and really good to see you again here today. And can I also acknowledge the traditional owners of our land, the Gadigal people of the Eora Nation, and pay respects to elders past and present, and particularly highlight the work that Black does to support Aboriginal queer voices, First Nations queer voices, and I've been glad to work with them on my upcoming equality bill. I'd also like to give a real big shout out to this panel. As both Penny and Brad had said, we all work really closely together for our community. You know, whenever there is legislation that targets the LGBTQI+ community, Jenny and I work as a team in the Legislative Assembly to combat that, to reduce its impacts. We've sat on inquiries, like inquiries into religious freedoms together, and we work closely to make sure issues important to the LGBTQ community are always progressed. I'm really grateful for that partnership with Jenny and the Greens. Penny has been a stalwart of the LGBTI community, and I don't think we can underestimate the impact of having an LGBTQ person at the highest levels of the Labor Party in New South Wales, and the important voice that she has in supporting our community. I'm really grateful that Penny is in our parliament and in the Labor Party. And Brad, who I will sorely miss as a colleague, but hopefully still as a friend after his time in Parliament. Brad and I have worked very closely during my 10 years in Parliament, whether it has been in his time as Attorney General, and he mentioned some of those reforms we were able to do together, but probably it's been more as his time as Health Minister, when we've been able to work together on the decriminalisation of abortion, along with Penny and Jenny, most recently on voluntary assisted dying, but on also the LGBTI health strategy, something that is a really important policy for our community. And it's more than a policy. Importantly, it's also a lot of funding. Millions of dollars of funding towards community organisations has flowed as a result of that health strategy. And that's critically important. That's gone into suicide prevention, that's gone into mental health, that's gone into the LGBTI Health Centre, which ACON is working on. That's really, really significant. And if you have some spare time and you want a good laugh, I suggest you watch Brad at Estimates taking on Mark Latham. It's compulsory and very enjoyable viewing. I'm really proud to represent Sydney as an openly gay man in the Legislative Assembly. My pronouns are he, him. As you would know, I've committed to legislation that will seek to modernise our laws and remove all LGBTQI discrimination from New South Wales law. That will include a ban on conversion practices, and it's great to see both major parties coming out in support of that. Obviously, there will be detail we'll need to work through. I've got the legislation ready to go and look forward to the discussions with the major parties. It'll also mean modernising our anti-discrimination laws to end grounds of unlawful discrimination to people who are bisexual, asexual, non-binary, have variations in sex characteristics, are sex workers, and more generally on bounds of sexual orientation and gender identity. It will seek to update our state documents. So many of our documents are very binary, very limited. It will seek to update all those. It will also decriminalise the sex industry. As Penny mentioned, repeals remaining in the Summary Offences Act for sex work, which is critically important. It will protect children who are born out of surrogacy. It will identify outing as a form of domestic violence. It'll do data collection for LGBTQI First Nations people, and it will also legislate public sector diversity and inclusion. So I look forward to working with colleagues on this wide legislative package. This bill came along because it was actually my mum's idea. She was sick and tired of seeing the LGBTI community always having to defend ourselves against attacks under the guise of religious freedoms. She said to me, the best defense is a good offense. You need to move forward. You need to make sure you're protecting your community and law. And that was the birth of the idea of the Equality Bill. And it's nearly ready. It'll be hopefully one of the first pieces of legislation our Parliament can deal with. But in addition to that, I just want to assure all the organisations here that I look forward to continuing to work with you in the next Parliament, whether it's on law reform, whether it's on countering bad laws, whether it's ensuring your organisations are properly funded to do the work and to change the lives and to help the lives that you do, I just want to thank you for the strong working relationship we've had over the past 10 years and hope to have another 4 years working with you all. Thank you.
Thanks, Alex. And last but certainly not least, Jenny Leong, member for Newtown and the Greens spokesperson on sexuality and gender.
Thank you so much, Anna, and thank you all, particularly thank you, Michael, for that welcome. Michael has been welcoming people on Gadigal land today because after Michael welcomed Clover and Alex at the Cycleway, he welcomed us at the Greens at our Deaths in Custody launch that we had at the National Centre for Indigenous Excellence with Linda June Coe, who is on the Greens upper house ticket and someone who I hope will be taking the last spot in the New South Wales upper house as opposed to the second Mark Latham One Nation person next week when we vote in New South Wales. So whatever you do, vote Green in the upper house, put a First Nations woman there. I would like... you try and out-left me all the time, Brad, but it's just not going to happen. I'd like to acknowledge that we are here on the land of the Gadigal people of the Eora Nation and pay our respects to elders past and present and recognise that it always was and always will be First Nations land. I acknowledge that there are people up here that have worked collaboratively a lot of political divides in our parliament to make sure that we can deliver the reforms that we need. And I appreciate the fact that if we want to continue to make those reforms, then we need to look at the ways and the opportunities for where there is multi-partisan support for issues to advance equality in our community. When it comes to commitments around banning gay conversion practices and so-called gay conversion practices, it is very welcome to see that there is multi-partisan support for moving forward on those issues. It's obviously clear in the context of World Pride that there was cross-party, cross-political landscape views in celebrating World Pride, as there is multi-partisan support for Mardi Gras and participation in Mardi Gras. But I want to take a minute to recognise the fact that there are areas of law reform and change that we need to see in New South Wales that have been left behind for too long, and that successive governments, both Labor and Liberal, have not taken those issues up. And I do not think that it's a reflection of the individuals sitting up here today, but I have seen the dangerous, homophobic, transphobic, anti-sex work, racist behaviour, discriminatory behaviour of people in both major parties when we're dealing with issues of religious freedoms, when we're dealing with issues of trans and gender diversity, when we're dealing with issues of how we ensure equality and the treatment under the law of sex workers. That's not to reflect on the individuals up here at all. But we are here at an election forum, and while this community has particularly been highly successful, and I acknowledge the incredible groups that are part of this forum tonight in bringing people together across party lines in the interests of equality and communities, and acknowledge the work that people have done to achieve those reforms, we need to also recognise that flying the rainbow flag, that showing a sense of pride, comes also with obligations, with expectations, to face the reality that still to this very day in New South Wales, our Anti-Discrimination Act allows sex workers to be discriminated against. It allows trans and gender diverse people to be discriminated against. It has no mention of people to be protected as a potential attribute for people that are bisexual, nor intersex protections, and nor does it recognise the need to address the ongoing challenges about the exemptions in those laws that literally makes it legal for people to discriminate against others if they work in a small business or they're part of a religious organisation. As someone who grew up with occasionally being called names that involved a horrific rhyme and twisties and an eye movements, I was told that sticks and stones may break your bones, but names will never hurt you. And I think that is the most bullshit phrase I have ever heard in my life. The reality is that when we allow in our laws discrimination that empowers people legally to be able to treat people unequally, the real harm and impact on human lives, on individuals, can be felt and can ricochet throughout our communities. It's not okay that our parliaments sit by because of the challenge that faces us. And I acknowledge that there are people in this audience tonight who have worked hard to try and see reform on anti-discrimination law. And I can give you my commitment and the Greens' commitment that we're not going to wait any longer. that we need to move on these reforms. We need to get rid of those religious exemptions, and we need to ensure that everybody is protected in our law, in our Anti-Discrimination Act. We also need to do something that I think is really critical, because we talked and we've heard about the idea of the protections for people based on evidence, particularly when it comes to a health approach to dealing and supporting with the LGBTIQ+ community. But we need to recognise that there is actually one issue here that we did see, sadly, bipartisan support, and that was the mandatory testing, disease test, the mandatory spitting laws that were passed through. And I know Alex and I exhausted ourselves trying to be able to see that change not happen. I give a commitment that the Greens will work hard to make sure that is repealed. There was no reason for that, and that is something that we need to change. So I'm sorry to bring down the bipartisan mood, but I do think it is critical in the interest of recognising the impact on people's lives that we actually push the boundaries in elections. People trust that I will always do that. I'm the member for Newtown for the Greens after all, and I say that we must continue to do that because nothing less than equality is acceptable.
Thank you all. Well, what a beauty pageant tonight. Can't wait to get stuck into some questions. We do have some microphones here for the panelists. Reg is going to help hand them out and also give instructions for people that need them. Just press the red button on the bottom to turn them on if you're having trouble. I'll just start to read our first question. I've got 3 here, and then we're going to go to the floor for questions from the audience that have been registered in advance. And this one, I've seen the Greens and Alex's responses, so I know that they've got a good response to this one. So we might start with Labor and the government, and then move to Jenny and Alex to see if they have any further comments afterwards. But the question is, the questionnaire calls for a minister or spokesperson for LGBTI communities, along with the establishment of an office dedicated to LGBT issues and an advisory group made up of community members to allow for ongoing community consultation and engagement. What would you do in government to ensure that the issues of our communities are prioritised and that our communities are heard? Starting with you, Brad.
I apologise that I haven't seen those questions, but my view on that, it is my view rather than all parties, is that there's a lot of work already going on. I mean, I would have thought that each of the parties that are sitting here have been listening intently. And I'm not sure how that office would work, because you've got to cross over between, for example, just even the discussion so far, health, justice, and a range of other agencies actually. So I don't know how that would work, but and it's up to the Premier of the day, I guess, when we get, well, whoever gets elected to determine that. But I think there's been a lot of work done again on both sides, and hopefully, well, don't get me wrong, we still have some troglodytes on every party. But mostly I would have thought today, and that, what was that? You got rid of your troglodytes. And I think, look, I genuinely think that both Labor and Liberal and the Greens are all well and truly aware of the do everything possible to try and avoid discrimination. Just accept people for being people. But I can't really answer the question in the specifics. I better not tie my Premier up when I won't be there in 9 days.
That's all the more reason.
I'll go on, she says, go on.
Brad.
After 32, can I tell you, look, I think in my 32 years, what I would say is I've seen a hell of a difference, just particularly in the last 10, 15 years. And I think that there's a lot more progressive views and a lot less prejudicial views held by members of Parliament. The bulk of Parliament people, the parliamentarians on both sides, are well and truly aware that you must not have anybody feeling like they're just being discriminated against. So whether or not having a separate office would work, I can't answer that. I just don't. I'm not sure it would actually.
We do have really wonderful examples that have worked successfully in other jurisdictions.
Where?
In Victoria and the ACT. The Chief Minister's responsible in the ACT in Victoria has an equality portfolio, a branch of government, and it really makes a difference for...
Who's the Minister, Anna?
Harriet Shing. It was Martin Foley for a number of years.
Oh, Martin. Well, I know Martin really well. He was the former Labor Health Minister, a really nice bloke. I'll have a chat to him about it. And then if he thought it was working, then I'll certainly suggest it to my side that they should think about it as soon as the election's out of the way. Yeah, okay.
That's a win. Penny, what about Labor?
Yeah, we've basically said that, yeah, we're willing to consider it. We are wanting to set up an LGBTIQ plus advisory council though, which will sort of be charged with doing the kind of ongoing community consultation engagement. But the other part of it, which is part of the ask I know that you had around an inclusion strategy, that's where we see that would go. So, yeah.
Fantastic. So does that mean that, and sorry, I haven't seen the response yet, Penny, does that mean that
No,
Labor
it's
has?
supposed to, like, literally, I've got it here. So
Yeah.
I was told it had got in. So
No,
anyway,
but
sorry.
thank you. Yeah.
Oh, there you go.
Yeah. But just for the audience's benefit,
Yes.
immediately, so you're making a commitment around an inclusion strategy, is that?
Yeah, an inclusion strategy and an advisory committee. We're going to
Fantastic.
consider the spokesperson thing. We haven't come to that. It is actually up to the leader in terms of the way that operates. But that's where we're at.
Yeah. Even if it was a nominated person with a portfolio already, that was the nominated contact. I think that's what we find, is that just there's a lack of coordination sometimes.
Yeah,
across
I think
government.
that's right. I mean, I just think it makes sense. I mean, it happens informally, all of you that work with me. But yeah, in government, we're going to look at doing that better.
Can I just say, look, as you're talking, I'm just thinking, I've been working up with the Aboriginal community for a decade in Bourke. And one of the frustrations that I had was that we had a whole lot of, no disrespect meant, but to lower level public servants who couldn't make decisions. And that frustrated me for a number of years until I finally jumped up and down and said, we need to have a secretary or a deputy secretary who can actually be instrumental in driving what we're all talking about. Otherwise, it just disappears into the ether.
Yeah.
So I think there's a good argument just listening to what's going on to say that at the very least, you need to have a bureaucrat, probably in DPC, because they're the ones who cover the whole field, and they can drive the change. But and you could have a minister as well. Minister would have to be relatively senior, I would have thought, to be able to help drive the change.
Yeah. I think that's exactly what we'd like. And Alex, do you have anything to add on that point?
Oh, look, I would just say that, Penny has obviously been the go-to person for the LGBTI community in the Labor Party and has fulfilled this role really, really well. Brad in the government has also been very much the go-to person for the LGBTI community through the health strategy. Of course, not all policy and funding relating to our community comes through health, though. So we need to make sure that there is a broader ownership of this issue. I've met with and spoken to Harriet Shing, and I can see how the equality portfolio really works and is a really powerful way to make sure that our community has somebody at the cabinet table. Structurally, I think it would be good for a government to have an equality minister. As many of you know, many LGBTI organisations often come to me and myself and my amazing staff at Tammy, who everyone on this panel knows, do a lot of the policy work and a lot of the funding requests for organisations. That's the work which should really be handled in a ministerial capacity. So I think this would be really good. I will advocate to whoever forms government that they should have someone with a portfolio responsibility for our community. And to Brad's point, we should also have a very senior bureaucrat tasked with this responsibility.
And Jenny, anything
Yeah,
further?
thanks. I guess just to jump in, I think it's really important to recognise that we do have ministerial responsibility for a range of things where there is an intersection between other areas. Obviously, we have a Minister for Women, we have a Minister for Multiculturalism, and I think that it's really important to recognise that it wouldn't be unusual to see, and something that the Greens are supportive of, is the idea of creating a minister that is responsible for the LGBTIQ plus community in New South Wales. That said, and I appreciate, we're here at a forum organised by, in part by Equality Australia. As someone who has an understanding of the intersections of equality, I would be really, really concerned about the idea of the rainbow communities trying to claim the name of an equality minister when it was just about LGBTIQA plus rights. And I think it's really important for us to remember that actually equality and the intersection of that goes much broader than just the rainbow communities. And I think that we need to recognise that in how we go about talking about what this would look like into the future. So 100% on the idea of having ministerial responsibility for an LGBTIQ plus communities in New South Wales. I wonder if that's Alex Greenwich's balance of power ask. take on the new
Or Jenny
ministerial.
Leon's.
We've already ruled out taking ministries. Thanks, Alex. But I think that it's important to recognise that that is an important thing. It's important to look at it, what that looks like from a department level, but really important to also not find in the struggle for justice for LGBTIQ plus people to recognise the ongoing challenges around inequality in other areas of our society.
Yeah, absolutely. And some jurisdictions do take that approach. They have a human rights or equality portfolio for all of the communities affected and marginalised. I'm going to mix it up a bit. I've got 2 more questions prepared, but I think we should go to the audience now, if that's okay, and I'll maybe come back to one of these in a moment. Our first questioner is Alistair Laurie. Pronouns he, him. Alistair has submitted a question and the panel is ready to receive it. Thanks, Alistair.
As someone who was mistreated by serious to Brad Hazard, New South Wales will soon be the only place in Australia, the only place that allows religious schools to discriminate against LGBT kids. When will the Liberal Party finally act to protect some of the most vulnerable members of our community? To Penny Sharp, while New South Wales Labor has agreed to refer the broken Anti-Discrimination Act to the New South Wales Law Reform Commission for review, as far as I'm aware, it has not made any specific commitments about religious exceptions, and in particular in religious schools. When will Labor act to protect LGBTQ kids too? And in asking that question, I acknowledge the positive promises from both Alex Greenwich and Jenny Leong and the Greens to address this issue. Thank you.
Alistair, the constant dilemma, I think, of religious schools is what you're raising. I obviously don't support any prejudices whatsoever by religious schools. When will the Liberal Party or Coalition do what you want it to do? I think that hopefully in the next term of Parliament there'll be a lot more discussion about those issues and trying to strike the appropriate balance. I don't support any discrimination whatsoever, and I think you asked a more fundamental question as well in terms of, well, it came out of a horrible experience, the disastrous experiences that you've had, and that should never happen to any kid anywhere. And the Royal Commission highlighted just how bad that was. Hopefully all those issues will be sorted through the next 4 years. I'll be watching on with interest, Alistair.
Thanks, Alistair, and thank you for your ongoing advocacy in these issues every day. Labor's position, as I said, is what you've already articulated, which is, yes, we think that the 1977 Anti-Discrimination Act was groundbreaking at the time. It's a long time since then. It's had a lot of things bolted into it. It's still got a lot of, a range of exemptions, and our general view is that it's not fit for purpose anymore. But our commitment at this election is to send it to the Law Reform Commission. That is not to send it there forever. It's actually to really get anti-discrimination laws that are now modern and actually deal with the discrimination that in some ways wasn't even named when it was made in 1977, and it's taken a while even just to bolt some of those things in. So that is our commitment. We'll obviously be having a lot of discussions about those exemptions and what should happen with gay and lesbian and trans and queer kids. And as you can imagine, I've got pretty strong views about that, and we'll do those at the time. Sure. Yes, and you need to be able to get it through the Parliament, and dealing with wholesale anti-discrimination law reform is the way in which Labor wants to do that. I've just told you, we're committing to the review and we'll have the discussion there. And
so I think
right, okay,
Penny,
if that's what you, right.
Penny's provided a response, and I think it's clear the extent of the Labor commitment. It doesn't go as far as we would like, and that's pretty clear. But we do have people that have registered their questions, and we do want to make time for everyone. Penny, I assume that's enough on, you've got nothing further to say on that. Next question is from Ali Nissenbaum. Is Ali here? And perhaps while Ali gets the microphone, I'll just move to the second question from the organisations, which is another one from the questionnaire. And that's about asking the New South Wales government to commit to maintaining strong funding commitments and partnerships across government, health and community organisations to achieve the goals of the New South Wales HIV, BBV and STI strategies and the LGBTI health strategy that's been mentioned already, and increase peer-led health promotion and research. What will you do to ensure this commitment is maintained?
Directed to me, Anna, sorry.
Yes.
I think, look, off the top of my head, I think there's about 26 million already going into that. There's a lot more broadly across the research areas. And in all honesty, in my time, 6 years as health minister, I've never, ever, ever had New South Wales Health say that they're not getting the money they need to do that. So it's not a political thing. It's just make sure that when they come to us and say they need more money, they get it. So I would just say to people, don't worry about it. It's not something which has any political connotations to it at all.
And next, Labor.
I mean, we're committed to the funding. We'll obviously be reviewing funding as you do normally, but in the survey, we've committed to all of that work. As I said at the beginning, the reason why Australia has a world's best HIV response is because there's actually been bipartisanship in terms of funding for affected communities, and we have absolutely no plans to change that.
I mean, I can't stress enough, in my time as health minister, in 6 years right through COVID, I have never, ever been asked that question with a suggestion that there's some political interference on that. It just doesn't happen. You know, there's absolute understanding that bloodborne viruses, STIs, HIV, and so much more need to be appropriately funded with our researchers, and also make sure that there's money going into our community organisations so that our community organisations can work with health to ensure that they actually get the messages where there might be issues or gaps. I just don't see that as an issue at all.
The Greens, Jenny?
Just to say, I mean, it's clear on those asks, but just to add the other part of I think the health picture, which is useful to kind of put in at this point, is the Greens believe that gender affirming healthcare needs to also be integrated into our public healthcare system. And I think just in the context of us not maybe getting another question around that, just to recognise that both the need to look at sort of reproductive healthcare, abortion care and gender affirming healthcare is something that we want to see integrated fully into our public healthcare system. And I know that there are a lot of challenges around that. And going back to Alistair's comment earlier, obviously some of the challenges are that in a lot of places, actually healthcare is provided by organisations that have associations and affiliations with religious and private organisations that then aren't offering that. And there is a challenge in that space to actually ensure that that public healthcare is available across the board to everybody, wherever you live in New South Wales.
Can I say, sorry, can I say where a minister does have the power to do something is in an area like, for example, and Alex, in fact, one of the Labor shadow ministers and I worked together on this to do with, and Alex came up with this actually thinking about it, where I identified, talking to community groups and talking to individuals, that there wasn't sufficient money ending up where it should, in my view, on transgender services, particularly, well, actually in the Hunter and in Westmead. So I focused on the services up in the Hunter because it actually covers a vast area south as well. And Alex and I and another Labor member who I won't name actually got involved together, and it was cross-party collaborative, and ensured that when we went up there, we found that there was, this is where it gets a bit challenging. On the face of it, it looked like there was enough money, but then when we talked to the endocrinologist, and obviously it's a multidisciplinary team, the endocrinologist was only working for a very small proportion of her working week on the issues that needed to be addressed. And there was quite a large number of young people who were not getting the services they needed. And so what we did was we looked at that, and that meant that I then had to, this is how it works at government, unfortunately, I had to ask the local health district, why aren't you doing that? And that took quite some time to work through because they had their other priorities. And we had to collectively put that extra priority into the local health district, because so we actually care about this. and we want it done. And of course, then there's the argument, oh, we're taking money off some other section minister. But in the end, they found a way to do it because there's always some hollow log somewhere. And in fact, the other thing I remember we decided
I think I might just have to, just in the interest of time, just ask.
well, the other thing, just touchy on this, because it's important. We also looked at it and it was a hospitalised model. So I remember jumping up and down with my colleagues and saying, can we move this out of a hospital environment? So it became Maple Leaf. It's one of the things I'm very, very proud of. And I know Alex and the Labor colleague was very proud of that as well. We got it out of a hospitalised model. We got a lot more money and a lot better services. And when I went up there, the young people were they were so pleased to be in that different environment. So you can make a difference, but generally it's actually the health people who are coming to us to tell us this is what we need.
Thanks. And Alex?
I'll just give a quick answer. So obviously the Labor Party and the Coalition are parties that seek to form government. Therefore, the funding commitments they are given are really important, and the support that the Greens have given towards funding commitments is also critically important. I just want to highlight, as a local MP representing Sydney, we also have a role to play in advocating for funding. And I'm really proud, as the member for Sydney, to have secured a great deal of funding for LGBTI communities. Many of the cheques were signed by Brad, so thank you, Brad. This includes $4.2 million for the ACON Health Centre, $3.4 million to expand New South Wales health and gender, trans and gender diverse services, $2.65 million for training for health services that went to ACON, $1.78 million in mental health and suicide prevention. The Gender Centre got $250,000 in counselling support, and also $223,000 to fund a regional caseworker for trans and gender diverse communities. Equality Australia was able to get $300,000 in education and capacity building for queer communities. 2010, over $700,000 for youth mental health support. $30,000 to the BGF for a new vehicle, $15,000 to different strokes, dragon boats, and $15,000 to the Flying Bats. So I just want to make the point that you don't have to be a major party to get funding for the LGBTI community. You can also do it as an independent.
Thanks, Alex. Ali, thank you so much for waiting patiently. You've got an important question around the sex industry. Please do ask the panelists.
Thank you. Yeah, I would like to know what each of you and your parties are going to do to improve workplace health and safety in the sex industry.
Who wants to tackle this one first?
Well, I'm happy to start.
And I'm going to introduce a time limit now.
I'll be really quick.
Thanks to Brad. You've got a minute each.
All right. So I mean, obviously, a key part is obviously that repeal the remaining parts in the Summary Offences Act. But I know from being on the inquiry into the regulations, regulation of brothels in New South Wales, some of the workplace health and safety challenges, and I'll commit to working with SWAP and other organisations to make sure that there are proper protections and support in place. I was obviously part of that committee that was able to stave off some within the government seeking to recriminalise parts of sex work in New South Wales. We're able to prevent that from happening. While New South Wales has really good sex work laws compared to many other states, we obviously need to do more to support the sector, and I'll give you my commitment that I will be doing that.
Thanks, Alex. Jenny?
Yeah, thank you so much for the question. And I guess the big picture stuff that we've already discussed is the need to make sure that we treat sex work as work. We need to recognise that the same protections that are offered to workers within our society need to be offered to people who are doing sex work. And we need to recognise that there needs to be a destigmatisation around how we are making sure that people are safe in their workplace if they're engaging in sex work. The other part of that, which I think is critical, is making sure that we are amending the Anti-Discrimination Act to ensure that people cannot be discriminated against as sex workers, because obviously that then flows to a whole lot of other areas of protection and support. The other element that I think is really critical in this, and I think this goes to a bigger issue around how we're approaching it in a whole of government way and at a local council level as well, is that we know there are a lot of local council regulations that actually impact on people being able to practice sex work in a safe way, where they are safe, where their workplace is safe, and where they feel safe in their community. And so I think there's a lot more of a role that the state government can play in working with the Minister for Local Government to ensure that all of our councils across New South Wales are creating safe, are enabling sex workers to have safe places to be able to engage in their work.
Thanks, Jenny. That was exactly 1 minute. Well done. Brad.
Look, as far back as I can remember, I worked with groups like Scarlet Alliance, try and make sure that the various issues are addressed. I think Alex's comment about the fact that there have been those who've had different views from me on that. Yes, there have been on both sides of politics. But I think the work that has gone on so far, particularly with New South Wales Health, ensuring that sex workers are given the support they need would be something that we would definitely continue going forward. And of course, also the recent consent laws are something which hopefully will also assist sex workers. So I don't think there's any opposition whatsoever to making sure that we continue doing exactly what we're doing right now and even improving it. But as Alex said, there's been further parliamentary reviews that have actually indicated more work to be done.
Thanks, Brad. And
right.
Penny?
Thanks. Yep, very proud that we've got decriminalised sex work, but there's still gaps that have emerged over time. So we want to look at doing that, at dealing with that. I would flag that we have to not go backwards. This has been an issue in that in every parliament I think that I've been in, there's been an attempt to look at licensing and a whole range of those things, and it has sort of been pushed back so far. So we've got to keep, sometimes it's not just about staying still, go forward, it's just making sure we don't go backwards. And as I said, we're looking at a range of reviews, and those issues will be picked up, and always very happy and want to work with sex workers and their organisations to try and fix that up.
Thank you. Got another.
That the number of trans women who are sex workers in comparison to the general population is so much larger than any other group of people. And I want to say this, I want to say this to Alex, and I want to say this to Jenny, and I also want to say this to Penny. I don't care about the Liberals, that if in reviewing anti-discrimination legislation, that sex workers and sex work in that process of that review, of that, you are essentially discriminating against trans people by stealth by doing that. So know that if sex workers do not appear in that legislation when it comes to Parliament, you are not standing with the LGBTQI community. Thank you.
So thanks for those comments. We do have another questioner, Ken Pack, they, them, who's hopefully here this evening as well. Thanks, Ken.
Hi, my question to the panel is, will you introduce or vote for legislation allowing trans and gender diverse people self-identify their gender on ID documents without imposing medical procedure requirements, and bring New South Wales up to speed with Victoria, Tasmania, the ACT, South Australia, and the Northern Territory?
I'll go first with a simple yes. That is what we need to see. We need to see that change happen. It is not okay for people to have either faceless bureaucrats or medical professionals to intervene in how they choose to identify themselves for themselves. It should be up to those individuals to make that decision, and the state needs to make sure that that can happen. And until we can do that, we further arm the transphobic religious right and others in their ongoing attacks of the trans and gender diverse community, because what we are saying is that our current practices, our bureaucracies, our systems allow for questioning of people's ability to self-identify. And so if you have a system or a bureaucracy that is set up to say we don't allow people to self-identify, then in a sense you're opening up the ability and the space for people who actually want to cause harm on trans and gender diverse people in our community to say, well, it's okay to do that because actually you need to prove it. You need to do these things. You need to tick these boxes. And so as soon as you have to prove or tick a box or do something that requires someone to say that you don't get to determine what you want to put on your ID, that opens up the space for those other discriminatory and harmful behaviours to continue.
Thanks, Jenny. Alex?
Also, yes, and I've got the legislation drafted after 12 months of consultation with various groups. Looking forward to introducing it and getting it through the Parliament. It's time New South Wales joined with the other states and also the federal government in allowing people to be able to update their documents to, to reflect their true sexuality, their true sex or gender identity on them. I'm looking forward to getting that through the next term of Parliament, definitely.
Thank you, Alex. And Brad?
Look, I think the issue around the current legal requirement that the surgical intervention has to be there is something which really is problematic and challenging for people who are trans and gender diverse. I can't commit to that change. If I were in cabinet, I would be expressing a particular view, but we're now in caretaker and it has to be discussed after the election. So, but I think what I would say to you is that you just heard obviously Alex and Jenny expressing views. The Parliament is an interesting place, and Alex has been incredibly effective in arguing issues on behalf of the LGBTIQ+ community. And I've enjoyed working with him, but I'll say that I think the majority of the Liberal cabinet would be open to discussions about those issues and possibly to actually make some changes, but I can't guarantee it. And I won't be there, but I'll put the two bobs worth in even after I've left. Okay.
Thanks, Brad. We have been trying to have those discussions for some time, so look forward to having some results after the election. Penny?
New South Wales has fallen behind on this. Labor has said that we'll talk about it after the election. Well, no, that's not a no. It's actually not a no. And this is actually important.
Can I just ask, we've got an audience online, and this is a discussion where people have registered to ask questions. It's being done in a way that's accessible for people. And when you make comments from the audience, it's disrespectful.
And the other point is, I'm happy to talk to you about the.
No, I'm saying it's not. I'm saying it's disrespectful to people listening online that can't hear you because it's not accessible, because this is an online as well as in-person event and people have taken the time to register questions. Well, you just had a microphone. So there's a process around this, and it's so that everyone gets a chance to ask their questions and have their voices heard, and that the community can hear from our panelists, because we have really important questions to ask them on a range of issues in a limited time. And we do have five minutes left for questions. So I really want to make sure that the people who went to the effort of asking their questions ahead of time are able to ask those questions. So Penny, was that?
I've said what my answer is. I know that people don't like that. But the point is that I'm not going to come here and say things that are untrue or things that we're not going to do. So I'm telling you what we are going to do, and happy to work with, as I said, as I have for the last 17 years in Parliament on these issues to progress them.
Thank you. Thanks, Penny.
I'm happy to talk to you afterwards if you want to have a conversation.
Yeah. And if we do have time at the end, we can come back to this issue. It's an issue that we all care deeply about and we want to see change on. And I think it's important to remember that as well. Was that everyone on that question? Yes. We have another questioner on a really important issue. So I want to make sure she has the chance to ask the question. Sandra Perrin.
Hi. As a young intersex person in 1980, doctors lied to me and my parents about my diagnosis, performed surgery without informed consent and left me without any support or information about my intersex variation. While thankfully medical practices have improved a lot since then, many doctors still persist in withholding information and perform medically unnecessary surgeries on intersex children before they are able to consent. There is also a great lack of funding and services for the long-term healthcare of intersex adults. I have two questions. My first question is, if you're elected, what initiatives will you put in place to support the health and well-being of intersex people in New South Wales and protect our human rights? And the second question is kind of a very relevant question for right now. If you're elected, will you follow the lead of the ACT government, who was just committed to ban deferrable surgeries on intersex children?
Thank you.
I'm happy to start with that. I have been working with the ACT government and the drafters of their legislation to inform those aspects in my LGBTI equality bill, which will do exactly that. So we will have those provisions to put a consent framework around deferrable surgical interventions. I'll be consulting with the intersex community to make sure we've got it right. The ACT fortunately has led the way on this, so we do have some legislative basis to go on. Again, it's going to be part of my LGBTI equality bill. I'm looking forward to getting that through this parliament as soon as possible. These are provisions which should not be not be allowed in New South Wales. I can't imagine one member of parliament who once they get the education from the intersex community and advocates for the intersex community about the surgical interventions which are put without consent on infants in New South Wales, I can't imagine any member would not support legislative change. So I look forward to working with you and others to get this done.
Thanks, Alex. Jenny?
Yeah, thank you so much for the question. And just to confirm that the Greens have responded as well to the Intersex Human Rights Australia calls this election, and they're available on our website in full for people who want to read the full response and details to that. Just to say, absolutely, consent needs to be at the heart of this, and it's so good to see the reforms happening in the ACT. As an aside, it's a good power sharing arrangements between the Greens and the Labor Party there in the ACT that are delivering good changes around this, but also good changes around rent controls and addressing a whole lot of other issues. If I can just do a plug for rents, because I can't talk about any forum today during the election campaign without talking about rent caps. But can I just say that I think the other part of this is making sure, and I think Alex touched on it, in terms of the education, but also the role that people in the intersex community have to play in feeding into the decisions that are made to protect infants and young people who find themselves in that same situation, but also the educative response. And one of the key things that I keep pointing to when I'm talking to people about this is the incredible work that places like the Shepherd Centre does around cochlear implants and people that are born deaf. And the reason I use that example is because the way that they use peer-based support within the health system to have people come and talk to parents and inform them in a way that is actually connected to being able to explain and understand and support them from the beginning, that is informed by an understanding of the intersex community to be able to do that. It actually assists and supports people to be able to address the challenges that they need to and feel supported throughout those challenging stages at the beginning, but also throughout the rest of their life. And so I just want to say that I think there is so much more that can be done to involve the intersex community in how we go about providing healthcare and support for people of the intersex community as opposed to non-consensual medical interventions.
Thanks, Jenny. Now, I know that Jenny and Alex have to leave pretty much now, so feel free to leave when you need to, but we will have Brad and Penny for another few minutes before we close off.
Another function at 7:30, so I'm going to be out of here pretty quickly.
Yeah. So we'll
Can I just say quickly, I think consent, Sandra, is at the core of what you're talking about. And I think it's it's terrible that doctors would actually, and family for that matter, would make those decisions for little kids without consent. What I would say to you is that after the election, if this is going to be another progression in terms of an issue that clearly needs to be addressed, the community, the intersex community, needs to be talking to both the opposition and the government. I mentioned Scarlet Alliance a little while ago, and I remember when I was in opposition, a lady had knocked on my door from Scarlet Alliance. She was concerned about something the Labor government at that point had done. I don't think deliberately, it was sort of inadvertent with regard to sex workers. And so off the back of that, I was able to talk to the then minister, and we were able to make some changes that actually made a difference. I would just say to you, it goes back to Alex's point, education is crucial. And many members of parliament don't actually have a broad knowledge beyond what they've actually narrow little part of the world they've lived in. So you need to actually make sure that the education is paramount, and then from that will progressively become change. Okay.
Thanks, Brad. And Penny?
Yeah, I mean, I just think that we need to work more with people like yourselves and IHRA. We need to have that conversation. The best news is the ACT has progressed this. They've actually got us a working model. It is a very small place compared to New South Wales. I would make that point, as Andrew Barr would always say. But I think that we actually do have a model, and I think that it's opening the conversation. And the only other point that I'd make is I do think we do have a large education piece to go. As we know, within the medical profession, there's a lot of people who have very firm views in relation to this and are very persuasive. And I just think we need to sort of really hear from people like yourselves and be really happy to, if you're willing to do that, work more closely in educating MPs about it. Because I have to say that I get asked a lot of questions about intersex and intersex people, and there's just such a lack of understanding. And I think we could accelerate change much quicker if we can get people just even to understand where it's at and what you really, what's happening. Because I think they'd be quite shocked.
Thank you, Sandra. Thank you so much for your question, bravery. Now, Alex and Jenny, do you need to leave or can we have one more? One more. Yeah. We have Amber Loomis in the audience. They, them. Thanks, Amber.
Thanks. Hi. Bi plus people, that's bisexual, pansexual, and other multi-gender attracted folks, have high rates of poor health outcomes across a number of areas and are named as a priority population in the New South Wales LGBTIQ+ health strategy. Despite this, Bi plus community organizations and Bi plus specific programming is significantly underfunded in New South Wales. If elected, how will you ensure that Bi plus community-led initiatives are supported to improve our health outcomes?
Thanks, Amber.
So I can start with this one. Yeah, I mean, our commitments around this are, it's within the strategy, which is good. Tick for that. The funding arrangements we've said we're going to look at across the board. And the one plug I'd also just say is that the Labor's very keen to do, particularly with community organisations, is to get you off the funding merry-go-round and try to move to like 5-year contracts and to give certainty for staff and those kind of things. So what you're saying, yes, for those that write grants, I hear you. It's an important commitment, but in relation specifically to issues in bypass, I see that we can pick up those and look at that through the range of things we've agreed to, whether it's an inclusion strategy, whether it's agreement to the funding, and also looking at the funding generally, which all new governments do. So,
thank you.
If we get there.
Let's move down, Brad.
I didn't actually, I mean, that's the first time anybody's actually said to me that it was underfunded. So maybe if you could let me know afterwards just how much money we're missing, then I could ask Dr. Chant and the health team what the hell's going on with the funding. So
I think we can come up with that, can't we, Amber? Yeah. Jenny?
Yeah, thanks, Amber. I think it's really important. I think in a similar vein to how I started the idea of there are parts where actually being able to talk about the LGBTIQ+ community is great in terms of being able to bring people together and look at the coalition of groups that are here. But there are other points in time where what that does is actually erase and risk the idea of erasure for certain parts of the community. And I want to acknowledge that particularly for the intersex community, but also for the Bi plus community as part of that challenge. And I think it's really important for us to recognise the intersectional diversity within the broader rainbow community and say that absolutely we need to do more around how we're amplifying and raising the need for individual involvement from specific people and communities with lived experience to feed into all of those processes, rather than seeing it as a whole blanket umbrella system to be able to how we're advancing the needs of individual parts of the communities.
You know, I'm happy to obviously meet with the Bi plus organisations, Bi plus groups, work on a funding proposal, take it to government and get it funded. Whoever forms government. I went through the list of the other organisations and funding I've been able to get. I'm sure I'll be able to get some funding for the Bi plus community and look forward to working with you in the next Parliament.
Thanks, Alex. Now, we do have 2 speakers that need to leave. I know there's been another forum scheduled, so I will call the event to a close. Yeah, I think one closing remark from each of you, if that's okay. 1 to 2 minutes. Yep, and also I'm sure even with the function at 7:30, Penny and Brad might stick around for some questions in person.
Me?
Yeah.
I've got to go.
Yeah, no, I understand. So 1 to 2 minutes each, just closing remarks. Anything else?
All I want to say is thank you. I think the point that Alex made about education and each of the issues, whether it's Sandra or whether it's that question you've just asked, I can honestly say that if I had known, and I'm sure, you know, if the Bi plus, I obviously had certain groups that have been in my door many times and they're sitting over there. But if I'd known that, then I would have asked questions of health. So And I agree. I mean, I won't be there in 9 days, but Alex will be there, hopefully. I mean, I shouldn't say that, should I? I support Liberals in Sydney. But nevertheless, he will probably be there. Whoever's there, I'll put it that way, more diplomatically. Whoever's there, you should talk to them and make sure that they come and talk to Dr. Chant or the then Health Minister, whoever is the Health Minister. Okay.
And any other closing remarks about other issues in the questionnaire or raised tonight?
Me?
Yeah.
No, I think that everything, it's a complex area and it needs a lot more education and a lot more understanding across the board. And it goes again to Alex's comment before. I've learned a lot in my 32 years, but I hadn't heard what you were just talking about. So, and I only knew a little bit about what Sandra had to say in terms of the intersex issues with little kids. So there's a lot of stuff that we don't know. And even I as Health Minister don't know, even though we had the wherewithal to get our first ever, be LGBTIQ plus health policy. There's still a lot more to learn and to be understanding about. And I think you just need to make sure that you're out there advocating. And I would say this, if I can be so, I understand that it's frustrating, but a calm demeanour when you're talking to the people that actually can make decisions does help. Coming with the facts also helps, because I've learned a lot from that way, from many, many different groups in my 32 years. And then if you have a minister on side, doesn't matter what political persuasion, they can try and start advocating within cabinet and within the portfolio to get the money. And generally people on both sides are pretty well intended. They're not evil people generally if they get into Parliament. With that, Anna, thank you.
Thanks, Brad. For your closing remark, Penny, what about you? 1 to 2 minutes?
I think it's all pretty straightforward. The groups that are represented here tonight are some of the most discriminated against in our state. We've made progress, but the progress is too slow, too often. And the way that we build a New South Wales that includes everyone in exactly the way they are, the people that they are, and they're celebrated for who they are, no matter who they love or no matter what their gender or however they choose to identify, that I think is the challenge. And I go back to some of my comments that I made at the beginning. I don't think we should underestimate that there are many who will fight very hard to not let the rest of the reform that needs to occur. And it's far better for us to be working together and standing together with each other on the issues that matter if we're actually going to get the progress that the communities and the most vulnerable people in our state actually need.
Thank you. Jenny.
Yes, thank you. Just to say that I think it's really important for us to recognise the role and the way that community pushes parliaments to change. And I want to acknowledge that while there are points in time where there's the ability to work collaboratively, where everybody gets along and is talking in a calm and measured manner, that actually sometimes the injustice is so great that speaking in a calm and gentle manner is not something that I sadly have the privilege as a non-white man in a suit to do all the time. And I appreciate that some people would prefer it if we could do that in a calm manner, but sometimes the rage is so great and the inequality is so huge that you feel that the only thing you can do is to scream. And so I want to encourage people to also scream. Yes, go in and have meetings in Parliament too, but also scream. But I also want to say that the Greens have got a long and strong tradition of being able to work with other people in a collaborative way, but also to bring the voices of people in our communities and on the streets into the Parliament to push for change. There is a theory of change that says that the more we go out there and push the boundaries, the more space we open up for others to be able to join and to shift the dialogue in that community. We did it. I remember being heckled at forums like this when we supported marriage equality back in the day when I was running in the federal seat of Sydney, because people said that marriage equality was not an issue. Sometimes that's the role the Greens play. Sometimes it feels a bit uncomfortable for us to be the ones to put that stuff out there. But I think that in the broader pathway to achieving justice and equality, we all have a role to play. And sometimes that means that I would encourage you all to push the boundaries, to expect more, and to not just go for what we can all agree on, but go for what you want to see as the equality we're trying to achieve.
And Alex, just to round things out.
I just want to thank everybody in the audience, both here and online, all of the organisations that have put tonight and the questionnaire forward. Obviously, you can see my response to that online. It agrees with everything. That won't surprise you. And I also really want to thank everybody on this stage, Anna and her team at Equality Australia, and for her job in hosting this event, and my parliamentary colleagues who I look forward to working with in the next parliament to progress equality for the LGBTQI+ communities. I'm really proud to be a part of the community. I look forward to continuing to work with the community. We have a number of challenges ahead of us, but as my mum said, a good offense is the best defense, and I look forward to powering through with my LGBTI equality bill through this term of parliament, so we don't have to be debating these things at the next state election. So please give yourselves all a big round of applause for your commitment to our community, and let's remove all discrimination and modernise our laws.
Thank you, Alex. You stole my lines. It's my job to thank everyone as well, particularly our wonderful panelists for their continued advocacy for our communities now and in the future. To Michael for his wonderful welcome to country, to ACON, to all of the organisations involved in the work. There was so much work. I know months and months of work behind this forum, the people involved in putting on tonight, the Teachers Federation for hosting us. All of the responses, I'm told, are now online. So if you download the QR code, they will all be there. Please do read them, to educate yourselves and make an informed decision when it comes to election day. Please do join us for a drink afterwards. We'll be in the Heritage Room, so there'll be canapes and drinks there. And I just finally wanted to close by thanking all of you, whether you're online, in the room. Thank you for your questions, thank you for your comments, and thank you for being part of this important discussion. Please end with a round of applause for our panelists and all of you.